tell you everything you need to know about it if you're considering using this medication. Semaglutide is one of our newest medications. Initially, it was created for diabetes and to help your blood sugar control. We found out people are losing a lot of weight on it. So we've been using it for that the last couple of years. Basically how it works is a couple of things. One is it acts on your pancreas and will increase your level of insulin to help regulate your blood sugar, but also you have another hormone that will try to increase your blood sugar, and it actually will block that from happening as well. The thing it does is will slow down how quickly food moves through your stomach. Again, that will impact your blood sugar, and it also will impact how full you feel. The other thing it does is actually will decrease your appetite. So those are all the things it's doing to help you lose weight. How much weight loss can you expect? There's been several studies done. They're actually doing some more studies that are longer range right now. You will lose, on average, 13% of your body weight. And for weight loss medications, that is quite phenomenal. The saying used to be that if you could lose 5% on a medication, that would be awesome. And so 13%, that is a huge deal for a lot of people. This is a medication we do use in the clinic, and so sometimes people are asked, like, when should they take it? Really, not really a big deal because it's something you take once a week. I do recommend people take it in the morning just to make sure that you don't forget to do it. With this weight loss, one of our main goals is to help get rid of fat, and so some people wonder if you're going to lose belly fat with it. Yes, that's going to be part of it. It's going to be part of your genetics, so it may be the last place you use the belly fat. When we do put people on a diet and we're using these type of medications, the goal is to lose fat. Belly fat is part of that. Based on your genetics, though, that may be the last place that you lose fat, but yes, it will help back fat as well. Another thing people are worried about is, is it safe? So that's actually the first thing that we look at for medications. A couple things that you may be wondering: if it's used for diabetes, will it make my blood sugar go too low? A recent meta-analysis, which is someone looking at a whole bunch of different studies and pulling that data together, showed that there was no increased risk of low blood sugar in people. And these were people who were using it for weight loss. Another question that's come up is, does it cause cancer? There's no evidence that it causes cancer. Thyroid cancer in some laboratory animals, these were at super high doses. And so the recommendation is, if you have a history of thyroid cancer, not take it, or if you have a history of what's called MEN, which is a type of cancer syndrome, you should not take it. Other reasons you may not want to take it is if you have pancreatitis before, though there's no increased risk of pancreatitis. The mechanism of action, some people are concerned that it may induce pancreatitis, though in the meta-analysis that was not the case. Side effects wise, the most common side effect that people do see is nausea. Now that is something that's common with a lot of medications because it's really working on the stomach tract or GI tract. You can get stuff like diarrhea. Sometimes people get cramping. Most of these side effects go away with time. Generally, I don't see much side effects in patients that I have on this medication. Now, semaglutide is approved for diabetes, and so it is not technically approved for weight loss, though very common use for that. That said, most insurance companies will not cover it, so you will have to pay out of pocket for it most of the time. And how does it compare to other weight loss medications or other diabetes type medications? So if we look at, for instance, metformin compared to semaglutide, weight loss is much higher in semaglutide. Matter of fact, those class of drugs, there's a few other ones. Semaglutide is the one with the highest amount of weight loss at year one. Now, there is actually another one that we're working on for a weight loss indication, and we're filming this in the summer of 2022. It should come out around this time, so we'll see how that works for people, but reportedly it has an even higher weight loss percentage, somewhere around 20%. One other thing you want to be mindful of is if you're pregnant or breastfeeding, there's really no data on that. Particularly if you're pregnant, you're probably not going to be on this medication because you're not looking to lose weight. Breastfeeding, we don't know. So probably better off not using it because we don't have any data on that. Well, that's everything that you should know if you're considering this medication. If you have other questions, comment below.